am Dr. Lewis with Spinal Health and Nutrition. Today, we're going to talk about an interesting topic. It's called frozen shoulder, also known as adhesive capsulitis. It's a very painful condition that can occur in most patients, especially if they're doing overuse work on their shoulder. What is frozen shoulder or adhesive capsulitis? It is an intense amount of pain that occurs with limited range of motion. The symptoms of that are pain and stiffness. Pain, stiffness, and also swelling. And what's happening with that shoulder is that around the shoulder, there's a joint called a glenohumeral joint. And what surrounds that glenohumeral joint is called a capsule. Whenever there's swelling on that capsule, that swelling will lead to scar tissue development. When scar tissue develops, it puts a whole lot of pressure on the nerve to the point that when someone tries to move either the right shoulder or left shoulder, not only that they will have pain, but they will have limited range of motion. What are the causes of frozen shoulder? And the causes of frozen shoulder is shoulder injury, and also surgery on the shoulder. And I mentioned earlier, overuse, wear and tear on the shoulder. For example, baseball pitchers, tennis players, golfers, when they use that shoulder over and over again, they put a lot of stress and strain on the glenohumeral capsule. So whenever the shoulder is in the sling, after surgery, oftentimes after surgery, the patient will wear a shoulder sling. When their shoulder is in that sling, there's no movement. And when there's no movement on the shoulder, a lot of scar tissue begins to develop because the body has a way of trying to heal itself. But when it goes through the healing process, there's some adhesion, scar tissue that's going to develop along the joint, and that's going to cause a problem, adhesive capsulitis or frozen shoulder. So let's get into the treatments, okay? I have my patient here who presents to the office with adhesive capsulitis or a frozen shoulder, okay? So which shoulder is bothering you? Is your left shoulder?
Yes, sir.
Okay. Now, have you had surgery on the shoulder or had some sort of injury on your shoulder?
No surgery, only a lot of working out, and I just feel a lot of pressure and pain.
And I read your MRI. I noticed it said you got some shoulder impingement with some swelling, and it showed some scar tissue formation there, right?
That's correct.
Okay. All right. Now, there are a couple of steps we're going to do. The first step that we're going to address before getting to the shoulder is the cervical neck area and the upper back area, okay? Why do we address those two areas? Because our main goal initially is momentum and function. Whenever we adjust the neck area and the upper back area, that will lead to an increased mobility on the neck and upper back, which will lead to increased mobility on the shoulder. Also, with the adjustments on those two areas, we're able to increase or enhance the communication process with the nervous system. On the neck, upper back area, we have the nerves, they branch out from the base of the neck to the shoulder. But whenever there's a lot of swelling, scar tissue development, spasms along this area, it's going to alter the communication process along the nervous system. When we adjust those two areas, it's going to enhance the communication process on the nerve, which will lead to a normal healing process. If the patient's pain level is extremely high, let's say that the patient's pain level is a 9 or a 10, I'm not going to adjust the neck and upper back and shoulder on the same day, okay? For the first couple of days, I'm going to work on the neck and shoulder to help increase mobility or functional range of motion. Once her pain level starts going down, and then we're going to concentrate more on the shoulder. So let's say your pain level is maybe between a 4 or 5, correct?
My pain level is 6.
It's about a 6. Okay. Her pain level is a 6, so she's still able to get some movement on that shoulder, but it gets to a certain point where she will experience some pain. Fortunately, I'm able to adjust the spinal area, the neck, upper back, and the shoulder on the same day. Now, like I said, if it was up to a 10, then we would have to wait a couple of days later or a week later, and then start doing some work on the shoulder, okay? The first step is we're going to adjust the neck and the upper back. So I'm going to do my exam, check her range of motion. Get back this way, that way, this way, that way. Rotate that way. Any pain there?
Just a little.
Just a little bit, and the pain is going to that shoulder, correct?
That's correct.
Okay. Now, apply some pressure here. Do you feel any pain here? A little bit?
Yes, sir.
Okay. I'm going to check her range of motion. I'm going to slowly bring her shoulder up. Any pain here? See, has some, some limited range of motion here. Then I'm going to come out to the side. Okay. Then I'm going to move her shoulder into extension. Do you feel any pain here?
Yes.
Okay. All right. So the good thing is she can get some range of motion. Now, if her pain level is at a 10, I will not be able to move this shoulder at all. Right? Like I said, the first thing I'm going to do is adjust the neck, upper back. I'm going to have you lay down your stomach. I'm going to stretch it out. I have you take a deep breath in for me. And breathe out. Relax. Good. All right. Take your time. I'm going to need you to lay down your back for me. Bring your head over this way. And bring your head over this way. Nice. Perfect. All right. How was that?
Felt good.
Felt good, right?
Yes.
All right. Now, try to move this shoulder again. Bring it out this way. A little bit more range of motion there, right?
Yes, sir.
Going this way. How was that?
Yes.
Good. All right. And extend it back. How was that?
Yes.
Okay. All right. So as you can see, address the base of the neck, upper back. And she's able to get more range of motion on the shoulder. So now the next thing I'm going to do is do some chiropractic work on the right shoulder. I'm going to concentrate on the glenohumeral joint, which is located right here, and the acromioclavicular joint, which is located right in this area. A simple chiropractic technique that I'm going to do to help restore her range of motion. After the adjustment, I'm going to show her some simple exercises that she can do to prevent the scar tissue formation from coming back. I'm going to ask you to just bend your elbow 90 degrees like that. Good. I'm going to come around this way. Then I'm going to gently, slowly bring your elbow up. Good. Okay, perfect. All right. Bring the shoulder up. How was that?
Good.
More range of motion there, right?
Yes. Yes.
Perfect, perfect. You can go back this way.
Yes.
Perfect. Good. Okay. One of the exercises that I'm going to show you all is flexion and extension exercises using a broomstick or a golf club. Doesn't matter which one that you're going to use, okay? I'm going to demonstrate it. You're going to stand towards me. So you're going to grab the stick. Then you're going to use it's your right shoulder, correct?
Yes.
So you're going to use your left hand to elevate the stick while you hold on to this end of the stick, just like that. Slowly like that, as high as you can, and back down, okay? All right, as high as you can, back down. This is called flexion. Extension, you will put the stick behind your back, and then slowly go up this way, and back down. Okay, back, and back down, okay? Right here, good, as high as you can. Can you go a little bit further? Perfect. Back down. Up. And back down. Okay. Then you're going to do extension exercises by putting the stick behind your back. Okay. And bring it back, extend it back, come up. How was that? Pretty good, right?
Yes.
And back down. Back. And back down. Perfect. One more time. And back down. Good. All right. Perfect. Okay. That's it. Okay. So pretty good, right?
Yes.
Good.
Thank you, Dr. Lewis.
No problem. It's important to go through those exercises with your patient Because without those exercises, then there's a tendency for the scar tissue and the swelling to come back, okay? Those exercises are very simple. Want to make sure you ice it down really good for 20 minutes after you do the exercises. And a good supplement to take is collagen protein fiber. That will also help reduce joint pain and inflammation. I'm Dr. Lewis. Please subscribe and share our YouTube channel. And remember, your health is your greatest investment.